Well, we've got an NHS that's being completely starved of cash, an NHS that is in no way overspent, an NHS that's simply catastrophically underfunded. Locally, it's actually even worse than it is nationally, because what we've got locally is above average health needs. In Shropshire, we've got an older population. In Telford and Wrekin, we've got a relatively socially deprived population. That means in both parts of our patch, we've got above average health need. We should therefore get above average health funding. We don't. We get rock bottom NHS funding. We get the 6th lowest level of NHS funding in the entire country, which is an absolute nonsense. If we got the average, we'd have in Shropshire, Telford and Wrekin, we'd have another £82 million a year. If we got the same as Cornwall, which you might think has a similar demographic to Shropshire, we'd have another £181 million a year. So we're being done over. This is real data. This is NHS England data. We contacted all our local MPs to tell them about this and see if they could take it up with the government. Out of the 5 of them, only 1 actually had the courtesy to reply. The others don't want to know. I don't think that's good enough. We've got the NHS nationally on a complete knife edge, and here, locally, if we don't sort out more money for Shropshire, Telford and Wrekin, our local NHS will fall apart. That's already starting to happen, and it's set to get much, much worse.
Hi, my name's Imran and I'm a doctor working in the NHS. Here's a really quick guide to answer questions about the NHS crisis. What's actually going to happen? Is the NHS really going to break, or is it all fake news? Oh fuck. Yeah, there kind of is, but this time it's gotten ridiculous. Over the last few weeks, reports from across the country show the worst waiting times in A&E for over a decade. Patients left for hours on trolleys. Vital cancer operations being cancelled. 66 hospital trusts declaring major alerts and 20 black alerts, which sounds as bad as you think. The Red Cross even called it a humanitarian crisis in the making. December 27th, 2016 was the busiest day in the NHS history. I remember, I was on call. God, the patients are crawling through the windows. The term bed blocking probably sums up what's going on quite well. Patients admitted to hospital end up staying in hospital longer than they need to because the deep cuts of social care means there is nowhere for them to go. That causes a ripple effect, meaning ambulance staff queue in corridors for hours to get their patients seen in A&E. More and more people are also coming to hospitals. People making unnecessary trips to a heaving A&E department doesn't really help either. Psst. What? Oh god, this guy's in charge. The underlying cause of the NHS's problems is relatively straightforward. Demand is going up at about 5% a year, as are costs at about 7% a year, mainly due to medical advances, but funding just hasn't kept pace. In fact, if demand grows even in line with government forecasts, the NHS will face a shortfall in actual funding of about $20 billion by 2020. But that's cool. We've got Brexit to save the day. That $350 million a week will come in so handy. Thank God we voted leave, right? Right?
The £350 million a week we send to the EU, which we will no longer send to the EU, can you guarantee that's going to go to the NHS?
No, I can't, and I would never have made that claim.
There's also nowhere to put patients. In 1987, there were about 297,000 beds available in England. By 2015, this number was just 130,000, that's a drop of about 56%. In 2014, the UK had 273 hospital beds per 100,000 population. Now compare this to Germany and even Greece, and one immediately begins to realise the absolute unremitting pressure on the system has become so bad that I've even had to cancel urgent operations because there's simply nowhere to put my patient after I've operated on them. Not quite. The NHS is also dramatically understaffed. There's a massive shortage in doctors, nurses, paramedics and many others. The government says it's going to train 5,000 extra doctors, but man, I've been in medical training for 13 years and I'm still 2 years from becoming a consultant surgeon. So don't hold your breath, because by the time there's 5,000 doctors are ready, the NHS have probably been taken over by something like Virgin Health, who can't even get the toilets on your train to work. Perhaps nothing at all. If the government feels things remain politically stable, the NHS will probably continue to decline with poorer standards of treatment, whilst those who can afford it go private for the healthcare. Alternatively, the government may opt for more funding, whether in the form of general taxation, the so-called health tax, or co-payments such as charging those who can afford to pay for GP visits, like with NHS dentists. A radical route would be to move to a social insurance model like those in Germany and the Netherlands. Private providers are brought in, and everyone is obliged to buy health insurance with the state covering those who can't afford it. The problem with this is that how will you convince private companies to take over loss-making areas such as A&E and elderly medicine? Private companies will just take the bits that make them money and leave the loss-making areas where the real problems are to get worse, and we end up with something like in the US. Whilst all this dilly-dallying happens, it's only the frailest and the sickest that are dying in our hospitals and in our communities. They're not dying in the streets like in poorer countries, so we don't notice, but if the NHS is working properly, they'll be dying in less pain, less anguish, or perhaps not even dying at all.
But I was told recently about a very elderly lady in her 90s. This incident happened in early March. An elderly lady with dementia, she had a fall, she got a head injury as a result of that. She was taken to A&E at Shrewsbury. She arrived at about 3:30 in the morning. There was no capacity at Shrewsbury A&E, so she waited on trolley for hours and hours and hours. She was seen by a doctor in the afternoon. The doctor wanted to admit, guess what? There were no beds, so it was back to the trolley and waiting again. And this very confused, very distressed, elderly lady with dementia arriving at Shrewsbury Hospital at 3:30 in the morning was given a bed at 4:30 the following morning. 25 hours for this woman to access basic care. This is an absolute disgrace. And if this is how we treat the most vulnerable members of our society, we are failing and failing catastrophically badly. And you want to know their solution? Well, short term, it's close down the A&E at Telford overnight, ferry patients around the country, around the county by ambulance, leave less capacity. The research evidence is clear, longer ambulance journeys to get emergency care, kill people. It's outrageous. It is genuinely outrageous. But our MPs are letting us down very, very badly indeed, playing the our A&E versus your A&E stupid game and failing miserably to fight for the funding that the NHS needs. That's not good enough. We also need our local council, Shropshire Council in particular, to be far, far more proactive and far more high profile in challenging the attacks. In terms of what's happening now, this is for real. It's crunch time for the NHS. 2017 is crunch time. We all need the NHS. We need the biggest, strongest, broadest, most united fight we can get to save it. Join the fight back. Let's keep the NHS all of us need.